Yay.
Hello and good evening to all the doctors who have joined us today for today's iSampark webinar. My name is Ishmeet and I'm Group Product Manager from Bhargav Phytolab, and I welcome you all to the iSampark webinar CME initiative of Bhargav Phytolab, sponsored by Spondent Drops. In today's iSampark, we have a young doctor with us, Dr. Ankit Dubey, who is a BHMS, MD, and PhD homeopath, and is right now associated with Rajkot Homeopathic Medical College. He is the HOD there, and today he's here to talk on a topic which is related to autism and homeopathy's scope for autism. So, before we proceed with the topic, a brief agenda for the day, which is definitely corporate introduction to know what Bhargav Phytolab is. Then we will have the session by Dr. Ankit, and in the end, Dr. Ankit will invite questions from all the participants. Talking about Bhargav Phytolab, we are Indian multinational homeopathic company headquartered at Noida, and our manufacturing plant is in Bhiwadi, Rajasthan. We have the largest production capacity in Asia, and wherein we are into homeopathic formulations, manufacturing of homeopathic formulations with strong quality assurance, quality and control, and regulatory department to ensure good quality medicines for your patients. We are into the manufacturing of the entire range of homeopathic medicines, which is mother tincture, dilutions, biochemics, biocombinations, SRTT, SRG, complex drop range, ethical tablets. Then we also have oral care products in homeopathy and dental care along with food supplements. Today, we are making mark globally. In addition to India, we are present in more than 34 plus countries. As we celebrate the 100 years journey in serving homeopathy, we have come up with various initiatives, which is for the homeopathic fraternity. One such initiative is iSampark, which is a webinar CM initiative. I think we have done more than 90 webinars in last few months. We also conduct Facebook live sessions. We salute Corona warriors, all the healthcare professionals. We are working on a new project with the name Go Dot. Very soon, we are going to be live with this project. We have our own in-house journal for all the homeopathic doctors. And then the sponsored brand for the day is Spondent Drops, which is for neck and shoulder pain and cervical spondylitis or spondylosis. Spondent is the most trusted brand by homeopathic doctors. So this is all for the day. Now I would request Dr. Ankit to please start share his screen and take us through the session. In the end, we would be sharing the digital certificates as well. Dr. Ankit, you are on mute mode. You need to unmute yourself.
Okay.
Yeah. We can hear you now.
फुल स्क्रीन करना होगा यहाँ से। नो प्रॉब्लम, यहाँ से कुछ स्लाइड शेयर। Good afternoon, everybody. First of all, I would like to thank Bhargav Phytolab for providing me this type of platform. Then I would like to thank Parole University, whose tagline is again, be here, be vibrant. And this particular university, again, very recently, I have joined this particular university, and I felt like the tagline which Parole University has given, it really justifies its tagline, be here, be vibrant. Parole University again promotes its staff and its workers to again go to various this type of webinars, seminars, and lots of involvements are there. I'm thankful to Mr. Devanshu, rather Dr. Devanshu Patel, sir, who is president of Parole University. Then again, I'm very thankful to highly energetic, versatile, dynamic, and humble personality of our college, and that is none other than our principal sir, Dr. Hitarth Mehta sir, who again used to promote his staff to do these types of activities. And then I am thankful to my colleagues, and lastly, I am thankful to my IT department, especially Mr. Ravi, who is continuously helping me out in doing this work. So again, let's start homeopathy's scope for autism. Now, one thing which I would like to tell you from this autism point of view, what happens in our day-to-day life, we used to see lots of kids here and there, again doing lots of activities, getting irritated, doing tantrums and all these things. Now, when I started going through this particular thing, I found out that all those kids were more or less having autism, rather they were autistic. Few were mild autistic, and if they are again having major autism problems, then there can be again immediately distinguished. But lots of parents are unable to again find out that their kids are autistic, so hardly they go for any treatment or any management for that particular complaint. And they used to again continue that particular problem with that particular child, and they are used to that thing. But again, let's start our session. So first of all, I'm starting again with the definition. This particular autism, it is again an abnormality or impairment that is commonly manifested before the age of 3. It can be again 1, 2, or 3 years of age, when the kid is again facing problem or the milestones are delayed. And this is characterized by the abnormalities of social development. Means when that particular kid is interacting with the persons, people present around that particular kid, initially those persons are again family members, mother, father, grandfather, grandmother, siblings. And if there is any problem in again interacting with those persons, there is problem in communication, and again a restriction of behavior and interest. This is another peculiarity which autistic persons commonly face. Maximum autistic persons do have this type of problem. And again, as I told you, it is again a developmental disorder that appears in the first 3 years of life. What happens when the development of the brain is more or less not normal, then these types of problem develops. We will discuss later on in our slides that certain parts of the brain which gets affected due to poor development, those part again sets back. So development of social and communication skill is there. Now, today we discuss again, it is a severe form of a broader group of disorders, again, which is referred as pervasive developmental disorders. Now, under this thing, pervasive development disorders, there are 5 points: autistic disorders, Asperger's disorders, then pervasive developmental disorder, not otherwise specified, PDD-NOS, then Rett's disorder, childhood disintegrative disorder. Now, all these 5 points, there are a little, what you will say, there are a little bit difference between all these things. Let's see. Autistic disorder, again, there is impairment in the social interaction, communication, and imaginative play. As I was telling, again, social interaction lacking in that particular child is unable to interact with his or again with her mother, father, siblings. Again, जो उसकी age है, in that particular age, if that particular child is supposed to, again, babbling should be there, or again there can be use of a one word or two word, that is not present. Milestones are more or less delayed. And imaginative play, this is again very important part. What happens ki in early life, kids used to imagine whatever they are looking around them. They used to imagine, they used to create their own theories, own what you will say, own world they create, and they start playing. They assume that this particular pen page, it is a crown, or according to their age, they start imagining that yes, this particular thing is this thing, say it is a toy, say it is a teddy bear, and they start imagining, start playing with that particular thing. And again, it starts commonly before the age of 3 years. Now, stereotype behaviors, interests, and activities. Now, autistic persons, they again continue with the same type of behaviors, means repeating same type of behaviors. They are not interested whatever going around them. So the activities are also. Now, if we see this Asperger's disorder, impairments in social interaction and presence of restricted interest and activities. Now, this thing is also present in autism, and no clinically significant general delay in language. Now, this is a little bit difference between autism and Asperger's disorder. Average to above average intelligence is there, means that the person is a little bit having this intelligence. And the thing which you have to remember, no clinically significant general delay in language. This is little bit difference. Now, a Rett's disorder. Now, this particular thing, it is commonly found in girls, but autism, it is what you will say 4 times more common in case of males. But Rett's disorder, again, it was found more common in girls. And period of normal development and then loss of previously acquired skills. Now, what happens? Ki certain age tak that particular child is or his or her, especially girls, if we are talking, her development will be more or less normal. Then suddenly, what happens? Ki that particular child loses previously whatever she has learned skills, again playing, doing things, or whatever. If again opening the things or playing with those things, suddenly that particular child loses that particular skill. Now, also loss of purposeful use of hands, which is replaced by repetitive hand movements. Now, again, this is a peculiar thing. Suppose if that particular child, depending upon her age, she has learned to open a cupboard. Now, after that particular, when this thing starts, she will forget how to open that particular cupboard, and the movement of the hand will be repetitive. Then again, if she's moving hands something like that, bagging hands or flapping hands, repeatedly that particular child will do the same thing again and again, again and again, and without giving a damn to whosoever is sitting or having nearby her. Now, this again begins at the age of 1 to 4 years. Now, next one is childhood disintegrative disorder. Now, again, normal development for at least the first 2 years, as previously we were talking, then significant loss of previously acquired skill. Now, in Rett's disorder and in childhood disintegrative disorder, there is a slight difference. In Rett's disorder, it is predominantly found in girls, and again, significant loss of previously acquired skill was present in Rett's disorder as well as in childhood disintegrative disorder. Now, I would like to share one short animation about autism.
The human brain is an amazing thing.
Dr. Ankit, it is not visible. We can just hear it. You need to share it again.
Okay, one sec. What you are telling, ma'am?
You need to share it again. We can't see it. We can just hear it.
Okay. Means again.
Stop screen sharing and then start it again.
Now sharing.
And now start it again.
Then I have to again select that particular slide.
Yeah.
And before playing, I have to share.
You have to select the video rather than the folder. Stop share. Now, once you click the share screen, you will get an option of the video. Click on that and then share it.
Again, it's showing a folder.
It is not showing the video?
No, inside that particular folder, it is. Then new share. But again, it's not playing. It's playing right now. Now, is it sharing or not?
No, it is not.
I have stopped sharing. Then again, I have gone to share screen.
You have to select the video. You have to open it first.
I have to
open, right?
And then
open. Now
but it starts playing.
It is not playing. It is not playing.
Okay, then
stop screen sharing. While selecting the option, while sharing the screen, when you are selecting the option, you need to click on the video rather than the folder wherein the video is.
sharing for video clip. Now, is it visible?
Yes, it is. It is perfect.
Okay, now I'm playing it from the very beginning.
The human brain is an amazing thing. It processes an incredible 400 billion bits of information a second. interpreting the world around us so we can see, hear, taste, touch, and smell. Most of us have what's called a neurotypical brain. This means we process information the same way most people do. But a small percentage of the world's population processes information in a different way. They have an autistic brain, which affects how they perceive the world and communicate with others. Maybe you know somebody with autism. That doesn't mean you know everything about autism. Autism isn't an illness or disease. It's a collection of related neurological conditions which manifest differently for each person. This is why it's called a spectrum. Every person with autism has their own unique characteristics and behaviors, which means they may react to their environment in a totally different way to someone else with autism. One autistic person might not be able to speak, but can solve complex maths equations. Another might paint beautiful pictures, but struggle to cope with bright lights and loud noises. The autism spectrum affects people across 7 different areas, including social skills, which affects their ability to interact with people in the world around them. Language skills, which impacts on their ability to understand what others say to them, read body language and facial expressions, or make eye contact. Information processing, which makes adapting to new environments or routines a challenge. Sensory processing, which makes them over or undersensitive to their surroundings. Behavioral and emotional skills, making emotional regulation difficult. Sometimes people say we're all a little autistic, but this isn't true. Autism affects people their whole lives and can make it hard to deal with the world. An autistic person has to come up with coping mechanisms a neurotypical person doesn't have to worry about. Autistic people who can talk and have reasonable physical coordination are often described as high-functioning. Yet they often have problems with getting jobs, making friends, having romantic relationships, or organizing their lives. If you meet someone with autism, instead of trying to change them, try asking about their lives and what autism has meant to them. You never know. You might learn something really cool.
Now, again, coming back to the point, historical overview. Now, this particular autism, it was initially firstly described by Leo Kanner in 1943, and initially it was termed as infantile autism. Now, why it is? Because the kid used to lock within themselves because they are having problem in sharing their thoughts, their feelings. They are unable to express what they are feeling, unable to talk, does not find proper words. Now, after that, for next 30 years, it was considered to be an emotional disturbance. Now, if we see the prevalence, 2 to 6 in 1,000 individuals are commonly autistic, and 4 times it is more prevalent in boys. Now, no one can be exempted from the problem of autism. No known racial, ethnic, or social boundaries are there for the autistic person. Anybody can have autism. Now, if we see the causes or etiology why this particular thing can rather happens, then first of all it is genetic factor, more common in monozygotic twins. As we all know, if one kid, if the two kids are monozygotic, if one is having problem, then quite obvious that another kid will also have the problem. Now, siblings of autistic children shows a prevalence of autistic disorders of 2%. Now, if there are two kids and one kid is having obviously this type of problem, so second kid is more liable to, more prone to develop autism. And it has been seen that there was elevated plasma serotonin found in the autistic persons, which can be again responsible, but again exact reason is yet not available. Then medical factors, postnatal neurological infections can be again reason for autism, or fragile X chromosome syndrome. These are the things which can be responsible to develop autism. Now, maternal bleeding after first trimester and meconium in amniotic fluid can be a problem. Now, these things are very common in our world. Parenting influence and social environmental factor. Now, parental rejection, family breakup, family stress, faulty communication patterns. Now, this uh, one thing I would like to share is this family breakup and family stress. Now, if a lady is pregnant, now if in her family this thing is happening, family breakup and family stress continuously it is there, so obviously it is going to affect that particular kid who is in her womb, and no doubt later on that kid may develop this autism. Now, mind blind, again, lack the ability to put themselves in the place of another. Now, autistic child, what happens? He, as we used to say, कि अगर किसी का दर्द समझना है तो अपने आप को उसकी जगह रख के सोचो. But this thing is not found in case of autistic child. Suppose if autistic child is sitting and playing in his this drawing room, and due to certain reasons his sibling or his mother is crying or in severe pain nearby him, hardly he will think about it or bother that yes, she is having some sort of pain or problem. He will continue playing with that particular toy. Then neuroanatomical studies. Now, enlargement of lateral ventricles and cerebral degenerations was found when autistic kid was studied from this point of view. Now, these are certain parts which again are responsible for certain types of works. If we will see this cerebral cortex, what happened? Basically, it is responsible for higher mental functions, general movement, perception, and behavioral reactions. Amygdala, again, it is responsible for emotional responses, including aggressive behavior. Now, if you will see, all these things are more or less what you will say responsible for developing this autism. Hippocampus, if you will see, make it possible to remember new information and recent events. Basal ganglion, agar dekhen to again it is responsible to help to regulate automatic movements. Brain stem, what happens? Again, it controls breathing, heart rate, and cerebellum. It again regulates balance, body movements, coordination, and muscle used in speaking. Now, if these particular parts or corpus callosum, again it communicates or connects the right and left hemisphere. If there is problem in any one or more than one part of the brain, obviously the kid will have autistic problems. Now, if we talk about the clinical features, there is problem in social interaction, impairments in communication, behavioral abnormalities, and cognitive abnormalities. Now, these 4 points will continuously run in autistic child, more or less. Again, depending if a kid is in an initial phase of autism or having mild autism, so these things can be of mild type. But as that thing progresses, it worsens. Now, first point is social interaction. As we are still talking, inability to make warm relationship with the people. This autistic child will keep on sitting at the corner of the house. Say if in his house one party is going on, or if his parent has taken that particular kid to any party or any function, he will not mix up. He will not greet persons warmly. Then he will sit at the corner. Again, avoid all the things. Children do not respond to their parents' affectionate behavior. Say if parents, mother or father giving love, care, they hardly feel anything. They do not respond properly to this behavior of their parents. They smile and look at others less often. Now, this thing is again very common in autism, that whenever anything good is happening, or say if any particular person is throwing a smile, they will not respond in the same way. Rather, they will not respond to their own name also. If somebody is calling them again and again, they will not show any interest. Rather, they do not care if anybody is calling them. They tend to their own things regardless of who is around or what is happening. Now, if any particular artistic child, it is holding one particular toy, then first of all, he's not going to share that particular toy with anybody else, and the kid is very very possessive for that particular toy. He will continuously keep that thing with him. Now, poor use of social signals, again, and weak integration of social, emotional, and communicative behavior. Now, if we are living in this social environment, then again we have to give social signals. We have to wave hello, hi if a person is crossing nearby, or any person or neighbor. Then, in case of autistic kids, they again does not bother who is at your neighborhood, who is going side by, कौन आपसे बात कर रहा है, who is saying hi hello to you. They never care about that thing. And very important thing is failure to make eye to eye contact. Whenever any autistic kid is sitting in front of you, he will never look into your eyes. He will see here or there, and then if you will ask, or if he says anything, he will never create eye to eye contact. Then impairment in communication. Again, failure to develop normal speech, as there is problem. We again in our previous slides we have seen that there is something problem in all those parts of the brain which are responsible for normal speech. So obviously there is failure to develop normal speech, failure to communicate by gestures. Again, as we have seen, by our gestures we used to communicate maximum body languages. Then autistic child lack body languages, body movements or facial expressions. Lack of social usage of whatever language skills are present means if that autistic kid is residing in any part of the world, and whichever is prevalent in that particular part, then autistic kid will lack that language skills. And delayed onset of babbling, unusual gestures. As the kid, according to his age, starts babbling, mama, whatever, then this particular kid will take more time as compared to the normal kids. Milestones are delayed. Now, diminished responsiveness, as again we have talked earlier, and vocal patterns that are not synchronized with the caregiver. Say if any particular parent or anybody is taking care of that particular kid, and if that person is asking for something, or again as we used to give love to our kids and we used to say something to the kids, then they will not respond in a simultaneous manner. It can be absurd or something very irritating. Their gestures are less often integrated with words. Now, both the things will not tally an autistic person. What they are trying to say, or what are they are telling, and what is the body language of that particular kid or autistic person. Both the things will not match with each other. And deficit in joint attention. Again, if we see autistic person, their joint movements are very very typical, unlike to the normal person. And autistic person will never request or share their experience. They will, as you can see in the photo, kid is sitting in the corner and rest kids are playing over there. So he will again never request ki, should I join your team, should I play with you. He will continuously keep on sitting over there. And again, environment in social imitative play. Difficulty with imaginative play and with developing symbols into language. As we talked earlier, lacking in imagination because they are unable to think properly. So imagination does not properly takes place. And this developing symbols into language. Whatever they are looking about symbols, they are having problem in converting this language. And lack of creativity and fantasy in thought process. Now, this autistic child, what happens? Key creation, if they are unable to use their imagination, then how come creativity will come in fantasy? Say if a kid, they commonly used to create their own world of fantasy, raja rani, then again pari, whatever may be the things, they used to live in that particular fantasy world. But in case of this autistic child, it is lacking. And echolalia, again, this is very important in autistic child. Continuously they will repeat one word or sentence again and again. This is very peculiar in this autistic kids. Now, behavioral abnormalities, restricted, repetitive and stereotype pattern of behavior. If autistic kid is doing one type of behavior, repeatedly he will do same type of behavior, same type of thing again and again and again. Commonly what happens, a kid gets bored. If he or she is playing with one thing, then after some time gets bored, he or she will try to get something new. But autistic child will continuously do the same thing. So this stereotype pattern of behavior is formed. Tendency to impose rigidity and routine in a wide range of aspect of day-to-day functioning. Again, they stick to this particular routine. If this routine is disturbed, they get disturbed. So their mindset is very, again, in a single line. If their routine gets disturbed, as I told you, they gets very upset, and rather they can burst out with anger. They will start crying. They will sit at the corner of the house. You might have seen kids, again surprisingly I have seen lots of kids जो कि अगेन रोड पे जा रहे कहीं भी है, suddenly they lie down, रोड पे लेट जाएंगे and start shouting, throwing their arms and legs. Means such a type of activities can be found in autistic child. So difficulty in generalizing newly learned skills to new situations. Again, as say if a kid is today, he has learned again to hold a pen like this, or say he got one toy, and to start particular toy you need to switch on that particular switch. So on the next day or after a week, if that particular kid gets same type of toy but in a different color, then he will face difficulty in finding out that particular switch from there to start that particular toy. So difficulty in generalizing new learned skills to new situations. This is found in autistic kids. Again, stereotype and repetitive plays there. Now, ritualistic behavior like checking and touching rituals and dressing up in a particular way. Now, what happens if autistic kid is again, he has got certain types of liking and disliking. If he love to wear this particular pant and shirt, and he will continuously try to put on that particular pant and shirt. He will not like to change his dress even. So if say his mother washes out that particular dress and he is unable to find out that thing, again he will get disturbed, start crying and doing all those tantrums. This is again found in autistic kids. Rocking, drilling, head banging, idhar sar marega, rocking movements, start jumping here and there, throwing things, and similar repetitive behavior are often seen, especially in autistic child. Overactivity, disruptive behavior, and temper tantrums, obviously, these type of things are found in autistic kids. Now, phobias, they have got certain types of fear from certain things. Say if sitting in a particular place, if in another place there is darkness, commonly in autistic kids there is phobia for darkness. So they will avoid going in dark. Eating patterns, if they like one particular thing to eat continuously, they will eat that thing only. They will not switch over to the another thing. Sleep is very much disturbed in autistic child. No sound sleep is found in autism. Now, cognitive abnormalities, poor at symbolization, understanding abstract ideas, and grasping theoretical concepts. Now, what happens? In spite of having these types of problem, memory can be excellent or good for a certain type of things. Commonly, autistic kids are good, say, in painting or doing in arithmetic calculations. Their mind is excellent in doing that particular thing as compared to the normal kids. Many autistic children enjoys playing music. Again, if this thing goes into their way and they will start enjoying music, they play very beautifully any instrument. Now, in spite this idiot savant syndrome, in spite of what happens, in spite of this pervasive impairment, lots of problems, they have certain islets of intelligence is still there. As we are talking about, they can be very good in mathematics, they can be very good in playing music, they can be very good in drawing or likewise. Now again, trying to play another video.
Today's topic is autism spectrum disorder. Autism spectrum disorder.
Where it has gone. Madam, is it audible?
It is audible, not visible. Dr. Ankit, it is not
Pardon,
very
madam?
clear. It is not very clear.
Voice is not clear?
No.
Clearly. मैं अभी दूसरा वीडियो प्ले कर देते हैं, it's not working then. Close.
10 early warning signs of autism.
Madam, is it clear?
Your voice is clear, but though we can't see it. You need to first play the video and then go for screen sharing option.
Okay. Stop sharing, then again we have to share video. कहाँ गया वो?
Ten early warning signs of autism.
Now, madam, is it visible?
No.
Is it clear now?
No, it is not visible, sir. Dr. Nirav is saying that first play video and then do screen sharing. And during it, click on the box of share computer audio. Then it will be clearly audible as well as visible.
Look at what I have done. कहाँ से? Stop sharing. Chalo, but then again, it's not playing, so we should move down. Time is running out.
Yeah.
We should move on to the slides on the slides. Now this case is visible, ma'am.
Yes, it is visible.
Okay, fine. Since it is video is not playing, so let me discuss one case. Rather, this is number of cases. Chalo, anyways. Now this is again a research work which has been done in a number of patients. 5 patients were there. I will move on a little bit fast. So first patient was again 4 years, 6 months old male child having this history of again pregnancy, gestational diabetes was there, and her mother was delivered by cesarean section. Cry of birth was immediate. Milestones initially that was normal. Sitting 7 months, crawling 9 months, walking 11 months. Dentition was normal. Its speech again receptive, expressive, and babbling at 10 months. Regression and 16 months. Currently has vocabulary of about 50 to 100 words. Mental symptoms, temperament of the child was very much sensitive, mild, obedient, crying, always needs somebody to be with him, especially the mother, but will not interact. Now, activity, it was hypoactive, does not respond immediately whenever called or spoken to that particular kid. Now, if we see the sitting tolerance, that kid can sit for 5 to 10 minutes at one particular place. Eye contact, obviously, it is poor, and response to commands takes long time and sometimes seems lost and will not respond to the whosoever is asking or calling. Occasional with self-injurious behavior is there with temper and tantrums. Reaction to anger, start head banging, feels better if left alone when angry or has to be consoled. Social skills, if you will see, then desires company, but in the next room, needs reassurance that there is someone with him. Will keep checking to see if parents are there. As we know, okay, this particular autistic kid, commonly what happens, they want somebody with them. Loneliness, they are again afraid of this becoming very alone. And further, if we will see, yeah, pressure cooker whistle. Now autistic kids are they have got fear, or they cannot tolerate bright light or very loud sounds. So fear of pressure cooker whistle, drum beats, and certain loud songs. If we see the performance in the school, there was good grasping power, does not respond immediately to the commands given by the teacher, but learns at his own pace. Activities preferred at the work or play, the kid likes to play in swings, again swinging motion, prefers plays with adults, अपने साथ के बच्चों से नहीं पसंद करता है. Reaction to holding and scolding and insult, what happens? Starts head banging, and when that particular kid is consoled, then feels better. If we see the obsession gestures, then stop signals, round objects, spinning, opening and shutting doors. Again, the kid likes to do these types of things. You see the past history, frequent tendency to catch cold was there, frequent blocking of the nose, nail bed infection at 1 month, followed by yeast infection was seen. Family history was not very much significant. Physical journals you will see. Then appetite was average, hunger pangs at night, wakes up and asks for milk at night. Regular motions were there, normal thirst, desire for sweets, olive fried curd, wheat, milk products. Now, aversion to spicy food and vegetables. Again, this can be taken as a normal because kids does not like to take these things. Sleep was sound, perspiration normal, urine normal, treatment history, again in on chelation of mercury toxicity. Now, likewise, this particular case, there is another case in which their 5 years old kid was there, again male. Pregnancy was uneventful, delivery full term. These things, again, I am moving a little bit fast because in the later pages I have to compare. Now, again, while going all these signs and symptoms, almost again, in this particular case, mental symptoms, the particular kid was very violent, anger, full of anger, destructive, wicked, incense, that he will search out and break things that are and favorites of his mom and dad, of anyone who scolds him. If we see the activity, the kid was very hyperactive, screaming, jumping, clapping, and tolerance. If we see the low, impatient, response to the command, does not respond as this autistic kids will do. Temper and tantrums were present. Throwing things, full of anger is there. Feels better if alone. Has to be left alone. Consolation aggravates in this particular kid. Social skills, if you will see, then wants to be left alone. Fears nothing significant. Activities, if we see, not specific. Now, I would like to tell you that these are 5 cases. We have to complete this thing. And then these particular things before treatment, before giving homeopathic treatment, baseline assessment was done following this autistic treatment evaluation checklist before treatment. Now, what we used to do, we used to give this particular charts to the parent of that particular kid, and we used to ask, fill in all these things according to your kids activities. Now, then particular numbers are given to these things and the scores are counted out. First of all, if we see this particular chart, speech, language, and communication skills, mein, if the kid knows own name, then if it is not true, you have to write down N, somewhat true, then S, very true, then V. So these are the 5 cases which has been taken and asked by the parents to fill in these things. Similarly, second is sociability. Certain points, again not descriptive, seems to be in a shell. You cannot reach him or her. If it is not descriptive, then you have to write down N. If it is somewhat descriptive, you have to write down S. Or if it is very descriptive, then you have to write down V. Now, not descriptive has given 0, 1, and 2 for very descriptive. This scoring is given. If no eye contact, then again we have to fill in prefers to be left alone, shows no affection, fails to greet parents. Likewise, moving on the third point, sensory and cognitive awareness, we used to ask parents that whether your kid responds to own name, responds to praise, looks at people and animals, not descriptive, somewhat descriptive, very descriptive. Again, marks are given on this basis. Then further, health, physical behavior, whether there is bedwetting, is it no problem, minor problem, moderate problem, or serious problem? Wet pants, soil pants.
Dr. Ankit,
Yeah.
most of the doctors are saying that the screen is not at all clear.
Why is it?
Uh, Maybe the font size is small, but yes, it is not clear.
Let me increase the font size. Now is it?
Yeah, a bit better, but still, yes, no, nothing is readable.
Oh,
Um,
then should I move it to the PPT only?
yeah, maybe yes.
So let me wind this particular
WhatsApp
case.
group. Okay, doctors are suggesting that if you can share this file in the WhatsApp group with the them.
Okay, that will be fine.
Yeah.
Okay,
Okay.
fine.
Yeah. So I'll add you in the group and you can further share it there.
Okay, no problem.
Yeah.
So again, we'll move to the my PowerPoint
There are
presentation.
certain questions that we should take after the session itself.
हाँ यार, उसको तो करने का चाहिए. So again, coming back to this PowerPoint presentation, now there are certain diagnostic criteria, certain exams and tests which can be done, routine developmental exams, language milestones, hearing evaluation, all these things are. And there are certain these, what you will say, questionnaires are there, screening test for autistic kids, certain checklist as I was showing, but it was again, unfortunately not visible. Complete physical examination was done. Nervous system, if the kid is having some sort of neurological problem or not, accordingly things are to be done. Then there are specific screening tools also. Autis, autism diagnostic interview, autism diagnostic observational schedule, childhood autism rating scale is there. Then Gilliam autism rating scale, pervasive developmental disorders screening tests are there. Now these are specific screening tools. By using these tools, we can find out that is this particular kid lies in which particular part of the autism, whether it is mild autistic, moderate autistic, or severe autistic. Now, which type of measurement this particular kid requires. So these screening tools helps in that particular thing. Now, in treatment, as we all know, other than there are certain medications in allopathy in which they can, what you will say, lessen the intensity of anxiety or anger, or by giving this antidepressants or like these sedative medicines. But there are certain behavior therapies by which we can do something for autistic kids. Development of regular routine should be there. If the kid is going school, then a structured classroom training should be there so that the kid is comfortable with that thing. Then positive reinforcement to teach self-care skills should be there. And if kid is having problem in this sign language things, and then speech therapy should be there. Now this thing ABA, this is most widely accepted evidence-based results were found while applying this behavioral therapy. Applied behavior analysis, which is again pioneered by Dr. Eva Lovars in 1960s. This thing is very found very useful. Now what happens ki very beneficial, most beneficial in young kids, but older kids who are having again severe forms of autism, in those kids certain changes are also found. 20 to 40 hours per week time should be given. Prompting should be there as necessary to achieve the high level of success. I mean, continuously we have to look in that yes, this particular thing is being followed on continuous basis. Now, therapist needs proper training and supervision. There should be therapist. Regular team meetings needed to maintain consistency, or otherwise these things will be not be continued. Speech therapy, occupational therapy, physical therapy, sensory integration, auditory integration therapy, vocational therapy. Now, all these therapies are needed for autistic child to again cope up his condition in order to behave normally in the society. So it takes a very tedious task. Again, for parents especially, they have to learn all these things, and again they have to depute certain therapists who comes to their home, or they can visit to that place, so in order to learn the kid. Psychotherapy, again this thing not very much beneficial in autism, but in case of parental counseling and supportive therapy are useful in, because parent gets very full of anxiety and guilt when their kid behaves abnormally in the society. So psychotherapy can help parents. Now it has been seen that if a kid is taking this wheat, barley, milk, cheese, now these things commonly used to promote this complaint. So if gluten-free diet or casein-free diet was given to those kids, there was a little change or difference was found. Now, possible complications, Fragile X syndrome, mental retardation, tuberous sclerosis, again, benign tumor is found. That can be a complication. Prognosis, again, obviously, is a very challenging disability, very hard to treat, but according to the therapies and by proper medications, it can be somewhat corrected if given in initial stages. Later on, again, it is a little bit difficult, which I can say. But then again, with care, with somebody's assistance, they can lead a little bit normal life. With proper therapy sessions, individuals with autism can improve their modes of communication and socialization to live very productive, independent lifestyles in society. Now, autistic children with IQ scores of 70 and above, they can live normal life and work more productive, independent lifestyles within society. But below this IQ scores, they need support. Now, again, I'm moving fast because already it's 5. Let me show you. Now, recommended activities. If autistic child, any activity that requires vigorous activity. Now, this particular autistic child loves doing, rather comfortable in doing hard work, walking, hiking, bike riding. So these types of things should be promoted. Swimming, which is again a very good exercise. So these things should be added up. And contraindicated. Now, autistic kids is not comfortable in any situation where there is loud sound, bright light, and again too much stimulus is there. So these things should be avoided, and lots of contacts also. Autistic kid cannot tolerate that lots of persons are coming and touching the kid, or lots of kids are again playing likewise. Again, these are again things which should be done in a school. Now, reduction of autistic features and rehabilitation into mainstream society of the child can be achieved through the classical homeopathic approach. If we take into account sensory patterns, kinetic states, regressive states, features pertaining to affects and mood, and qualified aspects to ascertain the totality of the cases. Likewise, we can more or less give benefit to autistic child. Now, as autism is a multifactorial phenomena wherein psychological, psychodynamic factors, mother's state during pregnancy, as well as suppression and vaccination can contribute to the emergence as well as maintenance of the disorder. Associated organic dimensions with autism, evolutionary study of the disease, developmental patterns, and dispositional features will also contribute in perceiving the totality. So again, this thing is important. Mother's state during pregnancy. We should give more emphasis in autistic kids while taking this case taking, that during the pregnancy time, what was the condition situation around that particular mother. Now, homeopathy offers a definite approach to the tender psyche and modifies the behavior of all concerned for good, not only of the child, but parents, teachers, as well as the whole society. So, obviously, if we are treating an autistic kid, parents will feel better, teachers will be comfortable, and so the society. Autism is also known as pervasive developmental disorders. It is deep-seated chronic disease. For homeopathic management, we need to appreciate the cases from the clinical perspective as well as from the homeopathic individualization perspective. Now, as per the case, if therapeutically indicated medicines we are getting, if the clinical perspective is more strong, we can again pursue for that thing, or otherwise, no doubt, individualization and proper case taking and repertorization is a good method. Now, when we study the symptomatology of autism spectrum disorders, we see various patterns. Some children present with predominant features pertaining to behavior like extreme restlessness, impulsive, while some children present with intense sensory disturbances like oversensitivity to noise, touch, and so on. Some children also demonstrate a marked degree of regressive features like involuntary urination, stool, eating filthy things, low cognition, and so on. Accordingly, we see a distinct repertorial totality. And so distinct groups of collected symptoms are, as well as group of medicines are there. For example, impairment in receiving and processing of sensory input with intensity as well as qualified aspects, touch, sound, smell, vision, etc. These sensory inputs bring about marked aggravation. Now, parents report that the child startles from sudden sound, closes his ears. Now, this aspect is a hallmark of autism and is responsible for a variety of symptoms and states. Similarly, our materia medica and repertory provide rich information of these aspects. For example, borax, stramonium, acerem, theridion, carcinosin, nux vomica, opium, china, and so on are the most important drugs which come up for the management of autism, where a sensory pattern is predominant. Now, likewise, there are certain medicines like Calcarea carb, Zincum metallicum, Helleborus niger, if the kid is slowing, answering, thoughtless. Now, again, all these medicines are having red line symptoms, which are again tallying with the autistic kid. Can be lycopodium, nux vomica, chamomilla. China, Ignatia, Muxol, Stramonium, in which again ceaseless talking, loquacious, very, very talkative kid. Again, that is a little bit peculiarity, but it can be there. Laughing, singing, rhymes, trembling. Now, rapid changes from joy to sadness and from sadness to joy. Hyoscyamus, coffea cruda, carcinosin, things with difficulty, indifferent. Now, this carcinosin medicine frequently comes in autistic kids. If we see the repertory, this synthesis repertory, then certain rubrics are there. Say if mind childish behavior, mind abrupt, harsh, children in, Pareto cup can be there. Mind irritability, children in. Mind slowness, children in. Irritability, children in. Pushes nurses away or cross all day and good all night. Mind irritability, children in. Good all day, cross all night. Grimaces, children in which the kid makes typical unusual types of facial expressions, then you can think of carcinosin. If the kid is absent minded, going to school, you can think of mind gestures makes repeating the same action as we talked earlier. Mind gestures makes childish, mind looked at to be evading the look of other persons. Now, these are the rubrics which can be again sensitive to light, sensitive to noise. Conversation difficult to carry can be medorinum. Absent mindedness spoken to. A kid is absent minded whenever asking anything, unable to reply. Loquacity, if it is there in children, you can think of before Alzheimer's, psychosis, and so on. Mind anxiety, children in. Mind anger, destroy things. Then antics, playing, children in. Antisocial, children doing lots of antisocial activities. There is mind autism, children in. It is also there. Behavior problems in children and capriciousness, children in. Behavioral problems, foolish behavior, lots of things are there. But then homeopathic medicines, if they are prescribed on the basis of totality of symptoms and miasmatic analysis, have effective results in cases of autistic disorders. Now, thank you all for giving me your precious time. So if there are any queries or questions.
Thank you so much, Dr. Ankit. In fact, it was a good session, I'll say. And yes, there are certain questions. Dr. Deepa is asking, does autism run in the family? Does autism run in the family?
Yes, in certain conditions, it can be seen.
Okay.
Yeah.
Another question, do you consider pregnancy history rubric in totality? If yes, then please let us know the rubric.
Now, again, we have to, as I told you, okay, if we are having autistic child or if family history likewise, so when the mother is pregnant, we have to consider her situation, her condition, that what was the condition, whether the mother was having under any stress, what are the family circumstances, and whether relationship with her husband is okay, and whether it means all these things should be considered and given very importance while taking a case of an autistic kid. So all these rubrics you are going to find in your synthesis repertory, in your radar or whatever software you are using. Right now, I cannot name all those rubrics, but then you can find out all those rubrics in this synthesis and any repertory.
All right.
Yeah.
Dr. Harpreet is asking, can autism be cured with homeopathic medicine?
Autism can be cured. As far as I have seen, we can again, if in an initial stage, if kids come to you, then we can manage his all those what you will say, abnormal conditions, expressions, gestures, all those things, we can lessen the intensity of these things. But if in the later stages, again we can categorize autism in certain parts also. So if the kids comes to in the later stages, again just as we used to palliate in homeopathy, we can do just like that for that particular autistic kid. But then in initial stages, no doubt very good results have been seen.
Mm-hmm.
Yeah.
Okay. So, all right, I think we don't have any more questions. In case, doctors, if you have questions, please ask. Dr. Ankit is here and he will answer all the queries. Though, Dr. Ankit, we are receiving many appreciation messages. You can check in the chat window. Doctors are appreciating your webinar. They are saying
Thank
it was a
you.
wonderful webinar.
Thank you, everybody. But then, due to scarcity of time, I have certain cases to discuss. There was some problem.
Maybe, sir, we will invite you once again and do take your cases and do
Sure,
share,
sure.
because knowledge
Anytime.
is everything and sharing is more important, right? In
Anytime.
homeopathy. So anytime you
And
can come, you can be there at this platform, iSampark, and you can share your cases.
yeah,
Right. Thank you so much, Dr. Ankit. Thank you, Dr. Hitarth Mehtaji. Because of him only this initiative we have taken. And thanks to all the participants who have joined us today. In case of any query, you can still answer us. Meanwhile, I have shared a link wherein you can share the feedback for today's webinar, and also you would get digital certificate directly on your email ID. So the link has been shared in the chat window. You can click on the link and you